Do you know that 41.9% of people are obese in the US? It's become something of a national crisis. Well, today I'm here at Prime Health Aesthetic, joined here with Dr. Tonthat, and we'll be having a discussion about weight loss and some of the treatments that are available here. So what do you think about weight loss treatment over some conventional methods of losing weight like dieting or exercise? Why do you recommend treatment?
Hello, good evening, and hello to everybody. I'm Dr. Tonthat, and that's a good question you ask. I've been practicing medicine for more than 20 years now, and after those many years of experience, I find out that people just do not have the time to do the diet and exercise, and at times they don't have the willpower to continue with the diet and exercise. And so we need other modalities to help them to lose weight, because obesity is such a big problem in this country right now.
Right. Very well said. So today we'll be going over some of the most asked questions from patients and getting a real doctor's response, obviously. So are there any side effects to your weight loss procedures, namely the EMS sculpting and the fat loss injection treatments?
There are always side effects to anything that we want to do. For example, there's side effects to eating too much. There are side effects to not exercising. So when you talk about side effects, we have to individualize to each patient. We do not know what the side effects will be until we actually try. But the treatments are no different than if you were to take any other medication. If you are taking other medications and you don't have any side effects of them, it's the chance of you getting a side effect from an injection is just as minimal. In terms of the side effect for the EMS sculpting, the side effect on that is no different than you using your cell phone every day, or any other radio wave from TV and microwave that is in your house.
This is a question more so for women who have concerns about their body after the treatment. Would this affect fertility in either men or women?
Another good question. Will it affect your fertility? There's positive effect and there's negative effect, because with obesity, sometimes there's a condition called PCOS where you can't get pregnant. And so one of the goals of therapy is to get our patient back to the ideal weight so that they can get pregnant.
How should my diet change immediately after treatment? I had read somewhere online that patients should be consuming somewhere around 20 to 30 grams of protein immediately after treatment to tone their muscles. So what do you think about this?
I think it's a good question. A way to think about that would be, you should not treat EMS sculpting any different than if you were to go to the gym. The purpose of you going to the gym is to build muscle, and so you should have a well-rounded nutrition. And if you're looking to build muscle, then you need to supplement your diet and focus on providing your body enough protein so that you can build muscle. So yes, because EMS sculpting is designed to help you build your muscles when you don't have the time. Yeah, by all means, you should supplement your diet so that you get the best result you can.
Right, and I think this is a great segue into another question, which is, would you say that EMS sculpting is some sort of replacement for traditional exercise and working out, or would you say it's a supplement to someone who's already fit and toned?
You ask all these difficult questions. To some, it may be a replacement. To others, it's merely a supplement. So why do I say that? A lot of people, busy people, do not have time to spend in the gym to exercise. So the second and best way for these people, the best option for these people, is to use EMS sculpting as a replacement.
Right.
And so that's how it can be seen. Personally, I think the best way is always the most natural way. If you do have time, go to the gym and exercise. But if you don't have the time, that's why the EMS sculpting is for people who do not have the time. And that's the population that is in trouble. That's the population that is obese, because they would not be obese if they have the time to do the necessary exercises.
Right. So on the topic of EMS sculpting, how much weight could one expect to lose? And while I know it's very much person to person on this, but in general, how much would you say, or perhaps I don't know, percentage of
right? That's a great question, and that's another difficult question. It is variable. It is all dependent on the person. Each person will come here with a different body habitus, and it depends on that body's habitus that you should expect your result. There are many among us who never exercise, and so they do not have that much muscle. And so each time you go into therapy, you don't expect them to be able to expend as many calories as the person who has a lot of muscle.
Okay. So on that same note then, is this a treatment for everyone, or is there anyone who would be excluded, someone who would not be ideal for getting this sort of treatment?
It is a treatment for everyone above 18 and below 70, I would say. As for people in between those two, that age range, the people that responds best usually is within the BMI of 20 and maximally 35. The higher you go up, the less energy gets to your muscle, and so the less stimulation that you're gonna receive. But that doesn't mean you don't get any stimulation.
Right.
And so, like I said, it really does depend on your body habitus when you come in. You may start out with a BMI of 40, but by the time you're done, if you continue at it, you may be down to the BMI of 35 or 30. Each of those times, when you get your treatments, your response is going to be better.
So it's more so a matter of people being, it works for everyone, but some people just are more conducive or maybe take the treatment better than others?
Yes, the better shape you're in when you start the treatment, the better the response.
So, again, while we're still talking about this, is there anything that could go wrong during this treatment?
I can't, presently I can't think of anything that could go wrong. Most of the people here are trained to use the machine, and we use it within the range and the specs that is recommended. We don't push you beyond, we don't use the machine to push you beyond your level of tolerance. And so if the room is well ventilated, there shouldn't be any mishaps, like the machine overheating or anything like that.